Research Department, and it's sponsored by Co-Project. So Co-Project is an acronym for Community Focused Oral Health Research for Equity, and it's a 4-year project, research project funded by UK National Institute for Health and Care Research to address the neglect of oral diseases in 4 middle-income countries, that is Kenya, Colombia, Brazil, and India. Here in Kenya, Co-Project office is situated at the Department of Dental Sciences in the University of Nairobi. In our today's webinar, we'll be tackling practical approaches to qualitative data analysis in health research. This webinar is scheduled to take about 1.5 hours, and at the end, of course, as being informed, we'll have a session to answer 1 or 2 questions that we'll have raised. And take us through this session is none other than Dr. Emily Nyariki. Dr. Emily Nyariki is a social scientist and a skilled qualitative researcher with over 15 years of research experience in population programs and health research, and more than 7 years in university teaching. Dr. Emily holds a PhD in implementation science and a master's in population studies from the University of Nairobi, where she currently teaches in the Department of Public and Global Health. Dr. Emily Nyariki specializes in qualitative research, particularly in areas such as disability inclusion, HIV, key populations, and research ethics. She is proficient in vivo and thematic analysis, and has led major research projects, including the Kenya component of the Young Africa Works Disability Inclusive Education and Employment Project. And with that, I would like to warmly welcome Dr. Emily Nyariki to take over and take the floor. Thank you so much. Welcome, Dr. Emily.
Thank you, Joyce. For purposes of introduction, I think it's best that I have my video on, so at least you can put a face to the name. And then I'll take it off because of the issues of the network. Yeah. So today we are looking at the practical approaches to qualitative analysis, data analysis, and focusing perhaps on health research. I just want to assume that perhaps a number of us have had an opportunity to collect qualitative research data. And so today our session will be on how do we go about analyzing qualitative data. So allow me to just take off the video, then we can proceed. This is from... I don't seem to get where it is, but all the same, because my, sorry. So as I look for where I'm going to switch off the video from. So the objective of our session today is to provide you with some sort of introduction to qualitative data analysis and its significance to health research, and examine some of the key approaches or methods of qualitative data analysis, and have a walkthrough. I'll try to give you a practical approach or process with an example of perhaps a transcript on how one would go about qualitative data analysis. And then we shall be able to look at some of the best practices, practical tips on how you can do data analysis, but also just looking at perhaps what are some of the challenges that you may encounter in your work as a qualitative researcher or when you're conducting qualitative research. So then what is qualitative research? When you look at qualitative research and quantitative research, perhaps that should be our beginning, is that qualitative research is more textual and it looks at the human experiences. So when you think about quantitative is more numeric, and qualitative is the human stories, the experiences that are shared by individuals based on their different context. So on the one hand, you have quantitative, that is numeric. On the other hand, you have qualitative, meaning then that if it is qualitative, it's a lot of the stories, the human stories that would be shared that you may need to analyze. So then how do you go about that? So what are some of the approaches that perhaps would be available for you as a researcher to be able to go through the process of analysis? Just a second, please, if you allow me. So I've mentioned that we want to be able to understand what qualitative data analysis is, the approaches that you'd be able to go through in terms of when you have your data. So the question one, research. So because we are saying this is a qualitative, if it's a qualitative study, so the modes of data collection in qualitative research often include interviews, in-depth interviews. You'd also have focus group discussions. You may also have key informant interviews. You may also have content that is in terms of pictures. For example, when you're having a research with perhaps children with intellectual disability, and they may draw stories about themselves, where they're coming from, about their experiences, or it would also be narratives about people sharing their experiences. So when you look back, you're looking at the methods of data collection from a qualitative perspective. So you may have, you could use approaches. For example, you want to understand people's experiences, and you could use approaches like phenomenological research in collecting data. Or you could also use a grounded theory approach in collecting data, perhaps where it is an area that is less researched. So whatever method that ideally you'd use in terms of analyzing your data may also be informed by the approach that is informing your research, in the sense that, for example, if you're looking at a phenomenological study, then of course it would mean that your analysis will take a phenomenological approach in terms of how you analyze it, whether it would be interpretive, whether it would be descriptive. Yeah. So, so the whole idea is that within the qualitative space, that the kind of data that you have, we're saying, is more text, that is rich, is more descriptive. It's not, it is non-numeric. So if it is descriptive, it means that you have stories of individuals describing the various aspects of their lives. And as a qualitative researcher, in terms of analysis, you want to be able to look through what are the patterns, what are the issues that are being, for example, what are the emerging issues from the experiences of individuals, perhaps, that you would be investigating. What are the meanings that they have? For example, you could be looking at a study that is looking at uptake of services in a health facility. Perhaps you want to look at uptake of family planning services. And with that, with the uptake of family planning services, you want to be able to understand their experiences. So based on that, you may find yourself that you're collecting data from different sources. For example, you may collect data from the healthcare providers who are providing data in terms of family planning. So within that context, then you have key informant interviews. You may also collect data from the women that are seeking services within the health facility. And within that space, again, you may be conducting in-depth interviews. Or you may also have, you'd be also talking to the MOH in terms of understanding the program areas, the policies that are in place. So you'd be collecting, it would be key informant interviews. Or perhaps, again, you may want to go further and have a social mapping, sort of like wanting to map where the services are available within the reach of the services within a given area. So you may have a social map. So within that space, then you have different forms of data that you may need to analyze. So looking at that, then, so you have different forms of data from qualitative research, and like quantitative, perhaps, where you just have a questionnaire that you may need to analyze. But here you have different forms of data that are from different types of people, but speaking to one objective from your study. So then you want to be able to look at what are the what are some of the patterns that are emerging, for example, when you think about adherence to treatment? So what is it that individuals will be talking about? Perhaps you talk about the caregivers, you talk about the people who are seeking care. And so then you want to be able, in terms of analysis, you want to be able to derive patterns from the data that you have collected from the different individuals or the different groups of people. Then, of course, what are some of the themes that would be emerging that perhaps would also be speaking to your study objectives? What are the meanings? What are the meanings of the data that is, what meanings do individuals assign to their experiences, for example? So within the context of qualitative research, unlike quantitative, usually qualitative data analysis begins even from the point when the data is being collected. What do I say when the data is being collected? So for example, you have had your first interview, and with your first interview, then you're able to go back and ask yourself, what message is being conveyed from this respondent? Of course, looking back from your study objectives, perhaps you may find that there could have been gaps that you did not anticipate, or there could be issues that you did not anticipate that were of importance to your research problem. So from that point, in terms of listening to the audio that you have from the data that you picked, you're beginning to have ideas of what is emerging. So when we say that it is iterative, it means that you're going back and forth, so that even as you're moving forward to the next interview, you're thinking about some of the other questions that you may need to ask that may enrich or may provide further understanding of what your research question is. Then, of course, you begin to have, you're having that interpretive idea. What is it? What is the meaning? Yeah. What is the context from which these individuals are speaking from? Because then individuals' experiences are also shaped by the context from which they're coming from. So for example, you might find the differences between individuals that are from the rural areas and individuals that are coming from perhaps the informal settlements of Nairobi. So you're looking at the context in terms of the differences, in terms of what would inform or what would shape the experiences of individuals. So we say that in terms of qualitative data analysis, that it begins even from the beginning of data analysis, from the data collection, and as you progress, you are continuously progressing in terms of your data analysis, because then you're having emerging ideas that are coming. And within that context, again, you might almost say, what are some of the emerging issues from this study? And you find that many times people would even just report on preliminary findings of a study based on a number of interviews that have been collected. So when you think about one of the aspects that is of importance in qualitative research in terms of sampling, we talk of that until perhaps there is no further information that is being captured in terms of saturation, because in terms of the numbers. So when you're collecting data and you feel that there's no more information coming, that you do not need to proceed to the next interviews because what is being captured, there's no new information. It means then that you have been through a process where you are listening to the data, to the interviews, and you feel there's no more data coming. So there has been some level of analysis that is informing you in terms of the next steps of your data collection. So that means that the analysis begins from the first interview as you progress on to the last interview. But when does the actual analysis then begin? It begins once you have finished the data collection. So let's move on to the next slides and see what they entail. So I've mentioned that some of the common types of data that you may need to analyze would include interviews. And of course, interviews may include in-depth interviews, may include key informant interviews. They may include also focus group discussions, observations. So all these forms of the sources of data, common types of data, could be speaking to one objective. So you have from one objective, you're collecting data about this one subject, but you're collecting from different sources. From you're having people that are using a service, you're having community members, for example, in terms of focus group discussion. You could also have participant observation within a health facility, for example, when you're looking at uptake of services in terms of the processes from one point to another. Then you could also have text in terms documents. You may also have digital data or social media forums and so forth. So this data then, how do you then ensure that you are able to analyze all these forms of data to be able to speak to one objective or a number of the objectives that would be within your study? So, our topic talks about practical approaches. Why are we saying why are we saying practical approaches? Because as you realize, you're collecting data from different sources, and although from qualitative research, usually the sample is small, unlike the quantitative, where perhaps you may have several numbers of people that you could be administering a questionnaire to. But within the context of qualitative research, you may find yourself perhaps having to conduct 12 in-depth interviews, perhaps even 3 focus group discussion, and even 5 key informant interviews. But how much of the data would you be expecting from those few participants? So you find that within that space, you may collect massive forms of data. And if it is massive, then it means that it may take you time. So there's the time aspect in terms of how much time you'll require to be able to read through the transcripts, to be able to get what issues are emerging. Then, of course, it also means it needs resources and time, unlike the quanti that you may just need to upload to the SPSS and run the statistics and come out with the perhaps tables and so forth. So there's also the need for balancing the rigor and pragmatism so that you're going back and forth so that you don't fall out of the true the scientific approaches that are in place in terms of analysis. So there's that navigating of a messy data, because then you could imagine a focus group discussion that has several participants and they have different views. So there's that back and forth in terms of the kind of issues that they're trying to share so that you're able to make sense out of it. So there's that messy data that you really need to be able to look through so that you're able to make a sense out of it, to be able to have some clear understanding of how it is speaking to objectives, and of course to be able to share it out to other people in terms of what the findings would be speaking to. So then we want to be able to see how then do you go about ensuring that you're being able to follow a systematic approach that can be that if another individual is looking back, they are able to look back through the steps that you've taken scientifically to be able to arrive at the findings that you have. So in qualitative research, there are different research designs that are available. And these research designs also inform the data analysis framework in terms of how you're going to analyze your data. So for example, you could also, you'd have thematic analysis whereby you're looking at the patterns and themes that are emerging from a given study, from a given interview. So even as you read through the interview, you're looking at what is it that is emerging. Or you could have, you could be looking at perhaps your study is looking at an area that is less researched. And if it is less researched, or rather it does not have much information that would inform a bigger study. So it means that you are coming from a point where you're looking into an area that is new. And the idea is for you to be able to develop a theory that would inform a bigger study. So based on that, then you want to be able to ask yourself, from this data that you have collected, the themes that are emerging, perhaps you have, and what are the ideas that would inform a theory that would inform a bigger study that should enable you to build a theory that perhaps you're able to do a study. For example, you could be looking at health-related quality of life for children through the exposure. Perhaps could be looking at the health-related quality of life of people living with HIV, and especially when you think about the uptake of ART. Yeah. So when you look at the available data, there's not much data that could be available to help you in terms of navigating that particular aspect. So then perhaps you may want to conduct a few focus group discussions with members of the community, or with people that are on ART, so that based on the information that they give you, then you are able to develop a tool. You're able to come up with a theory to enable you collect a bigger study to understand the burden of a given issue, or rather to understand the context in terms of the health-related quality of life of certain individuals. But you could also have narrative analysis, and within this context, perhaps you are collecting data about people's experiences. You could have case studies, for example, within a given population, and you want to be able to highlight a given experience among populations. So you'd have children perhaps talking about how they learned about their HIV status. Perhaps there could be children that have been born with HIV. So over the years, perhaps they didn't know they had HIV. So you want to be able to have that narrative analysis to be able to pick up certain issues that are emerging from their stories, from their narratives. You could also have a discourse analysis. Perhaps you're looking at policy. What is the language that is looking at the power dynamics in terms, for example, you could be looking at the human resource for health, and you're looking at the government's commitment in terms of the power dynamics, and you want to look at the conversations that have been over time in terms of supporting the healthcare workers, perhaps in terms of the resource allocation. So the discourses could be in terms of the policies, the programs that are in place, the conversations that have been over time within that given subject. So we're saying that depending on what study that you are engaging in, then of course the type of analytical framework that you choose will vary from one to another, as I explained. So then, given that background in terms of some of the frameworks that are available in terms of qualitative analysis, so then what is qualitative analysis? What does it entail? Yeah. So qualitative analysis often, as I mentioned, begins from the point where you're collecting data. And of course, it progresses on to the last, yeah. So there's the aspect of data collection, there's the coding, the analysis that occur simultaneously. So even as you go through the process, for example, you could be having a team of 5 research assistants, and at the end of the day, you get to meet and you have a debrief session, yeah. And within your debrief session, it means that they're sharing the experiences of the day and the kind of interviews they have had. Who did they interview? What is it that they picked? Because again, in terms of analysis, the nuances, that the unspoken data that may be picked as one is collecting data. So then that also becomes part of the data that you're analyzing, because it is some of that unspoken. So then we're saying you're having that comparative approach that is back and forth. So with the debrief sessions, it helps you in terms of moving to the next session, because then from your first day of data collection, so you have your research assistants and you get to sit down. Each of them is sharing their experiences of the day, who they interviewed, how they fared on with the interviews, what was emerging from the data, what questions were difficult, for example, what was not in terms, or what perhaps were the challenges in terms of administering the questionnaire or the tool. So based on that, it means that you're also picking aspects of the data that are of importance. Then of course you're able to understand, are we able to respond to the study objectives? And be outside of the study objective, what are some of the emerging issues that are of importance that perhaps we may not have considered when we're writing up the proposal? So there's that constant comparative method of back and forth. You're looking at the objectives of the study, but you're having those debrief meetings where you're sharing experiences on the emerging data. So early data are coded with words that describe the action. So often you'd find that depending on your approach of collecting the data, you may also require your research assistants to write their notes at the end of each interview. So you have a situation where you have recorded your data that you're expecting to have it transcribed verbatim. But before the transcription, you may also ask your research assistants, each of them, to write a summary of each of the transcript of each of the interviews that they have at the end of the day. So why is it important for them to be able to write those summaries, perhaps even a 2-page summary? That helps you to have some form of perspective, because with the summaries, you're quickly able to read through and have some gist of what is emerging from this data, yeah? So based on that, you're beginning analysis even from the summary notes that are being provided by the research assistants, or even through the debrief meeting. So you find that data analysis has begun long before you even finish the data collection, or even just before you sit down and have all the transcripts in, so that you're able to go back now, read the transcripts from the beginning to the end. So we're saying that early data could be coded in Word. So even when you start your data coding, so you have your notes that have been sent to you by the research assistant. So what do you do with the notes? You read through the notes, and oftentimes you may find yourself writing a few notes along the margin, thinking about what are the issues that are emerging. So you take notes along the margin. So as you move on, then of course you're in a space where, using the notes that have been shared by the research assistants, you can already begin to develop a code book that would inform the analysis once the transcripts are finalized. So then we're saying, with the notes, the summary notes that have been written out, before you even receive the transcript, you can start beginning to develop your code tree that will inform your data analysis. So ideally, in terms of summary, of course, I'll give you a step by step. So as you move on, you find that the ideas, then of course you get to sort of clean your idea. You get to a point where you're looking back at the ideas that are emerging, and you are refining the ideas as they emerge. And of course, those ideas, then of course, they become themes, and within those ideas, you're beginning to have ideas what would be some of the major themes, because some of the ideas, of course, speak to more others. So it means that you could have major themes, you could have sub-themes, and as you move on, then of course you're thinking about clustering, because you have many ideas, but of these many ideas, you need to be able to cluster them so that they make sense. So you have categories that would be linked across the board. I want to be able to move this. Thank you. So the process in terms of analysis, so we want to assume that you have been to the field, you have collected, perhaps you've had 10 in-depth interviews, you have 3 focus group discussions, and you have perhaps 10 key informant interviews. So how do you go about the process of analysis? Yeah, so I've mentioned early on that you have had debrief meetings with their research assistants, and you're able to pick out some of the emerging issues from the interviews, but also you've asked them to do a summary of the notes each at the end of each interview. So then it is giving you an idea that, of course, we had in-depth interview number 1 with a female. So these are the emerging issues. So assuming then now you have been through the process where you have collected all the data and you have had all the interviews transcribed verbatim. So what do you do then? So it means the first step would be to organize and prepare your data. So what does that entail? It means transcribing the audio into data, into text, yeah? Then of course you could also have the field notes that have been typed. And of course, with the field notes that are typed, it also means that the research assistant or the researcher is also able to include some of the unspoken experiences that I picked from the interviews. Then you may also have optical scanning materials depending on what your study approach. You may also have social maps or gender analysis maps. Then based on that, then you're able to sit back. So you have all the data that has been organized, and it is well documented in terms of, these are focus group discussion, these are in-depth interviews. Then what do you do with the data? So we want to assume that you have a team of 5, perhaps you're 3 researchers. How do you go about then the research analysis? So it means that you may select perhaps 3 interviews from the data that has been collected. You could choose to have 1 in-depth interview, take 1 focus group discussion, transcript, you take another key info from an interview transcript, yeah. So then assign yourself to read through the three transcripts. The three of you then would read through the transcript, read through the data to make sense of the whole. Then, of course, having to reflect, looking back, what does this mean? Then based on that, of course, because then you get to sit down as a team and ask yourself, what is it that was emerging from the transcript, for example, from the in-depth interview? Because then you want to be able to have a sense of commonality. You want to be able to speak from the same point, that you have the same understanding of what the issues that are emerging from the interview that you have been able to look at. So you're able to reflect on the meaning. So based on what is emerging, then you're able to ask yourself, what meaning do we assign to this? So for example, you may be looking at an interview and from that you're looking at uptake of services, and there could be reluctance of the population to seek services. And you'd find individuals saying, for example, if you look at the men in terms of prostate screening, and what would be some of the issues that would be emerging? Perhaps there would be cultural issues in terms of masculinity and how individuals view the issues of sexuality. Or perhaps there could be issues about individuals not having access to information. Yeah. So from the data, you're able to pick out what issues are emerging, and of course, you're able to derive the impressions of the emerging issues in terms of do they speak to the objectives of the study, yeah, and are they speaking to the realities of the men that have been interviewed in this study. So again, you also want to be able to assess credibility of the data that you're looking at, because then sometimes you may find that if you have a multi-site study, for example, you could be collecting data from Nakuru, you could be collecting data from Nairobi and Mombasa, but you might find that you'd think that you have a transcript that is speaking to issues that are in Mombasa, but then from the data that you're looking at, they would be speaking to interviews to the issues in Kakamega perhaps. So then you're looking at the credibility, because then you're able to understand the context here. Then of course, you're looking at the depth of the data in terms of completeness. So many times you find that if you have individuals that are doing the data transcription for you, you may have individuals that are not, that have no commitment to the importance of completeness, because they may decide that they're going to do summaries of the interviews, and they give you, perhaps if an interview was 1 hour, and you find that even when you look at the amount of data that is given from that transcript, you find that perhaps it's 5 pages. So you want to look at the depth of the data, the content, and of course, looking at the issues that are being discussed in terms of quality. Then of course, you're able to look at the credibility as you move on. And of course, many times that is addressed at data cleaning. But as you move on, sometimes again, you may find that some of those again may be picked as you do the analysis. Then of course, so as you're reading, you are able to take notes along the margins. So within the space now we're in the digital world, it means that if you're looking at your data from your computer, you may apply where you may have to write comments along the margin, so that you're saying this data, this is what is emerging. Perhaps there's fear, there's a vaccine hesitancy from the community, there are fears around collection of blood. So those would be some of the issues that perhaps would be emerging. So then based on that process of writing the notes along the margin, so together as a team, you're able to move on and decide. So how do we move on in terms of ensuring that now we're able to develop a code book based on the issues that are emerging, so that we're able to analyze all the transcripts in a uniform manner. So then step 3 would have a detailed analysis with the coding process, which is organizing data in big segments. So then assuming that you have been able to look through your data, and as a team, you have agreed on the themes that are emerging, and under those themes, you've been able to agree on the sub-themes that are emerging. And then of course, then you may decide now, how do we go about the analysis? Do we use a computer software, or perhaps because the data is minimal, you may decide to do it manually. So the next step 4, would be able to use the codes to generate description of the setting or the people, as well as the categories of themes for analysis. So I'd like to show you, you'd allow me to go through up to step, then I give you an example of a code book that has been developed, ideally what a code book could look like. So decide on the themes, on how many themes that you may want to have. And of course, for each of the themes, then of course you'll need to describe the themes. What do these themes mean? And then of course the sub-themes, what do they mean? The reason for doing that is for the fact that if somebody else was helping you to analyze the data and you gave them the data, for example, you have a data analyst, and you as the owners of the data, you've been able to go through and you have identified the major themes and the sub-themes that are needed for analysis, then it means that this person will be guided by what the framework that you have come up with. So the next step, of course, having done that, it would mean that after the analysis has been done, then you're able to pull out the data perhaps from in vivo and be able to have the interpretation to be able to draw your conclusion. So then what would be the process, the ideal process in terms of coming up with a code book? So you'll allow me to pull this down and then I show you an example of a code book from a study that I was previously involved in. So I'll stop sharing this one. So we'll pick it up from there. And then I'll share something else. So this is in Word. You'll forgive me if I hope you can see this well. Are you able to see this? Okay, so this is an example of a code book of a study that I was involved in some time back, yeah? And so over here, we have a major theme. So this study was among sex workers. So some of the themes that were picked was underlying context. And of course, this code includes the family dynamics, the cultural aspects, the gender dynamics within the household, yeah? And so then you are giving a description of a code. So this is the major theme. And then based on that, then you have sub-themes. So under the underlying context, then you have a theme that is looking at poverty and perhaps the reasons why they moved to the urban area. And then, of course, you may have to explain what this sub-theme, so that whoever is going to code is able to look at whatever text that is speaking to the issues of poverty, that is going to capture the issues of poverty, the impact of poverty at the household. Perhaps individuals have difficulties in terms of having basic needs and the reasons why they move to the urban area. So that within that space, then you have that sub-theme. Then you may also, within the underlying context, you may also have childhood experiences as another sub-theme. And of course, similarly to the first one, you also explain what it means, what is it that you want to be able to capture when you're talking about a sub-theme that is relating to the childhood experiences and family dynamics. And within this context, this code captures the upbringing and family relationships of the individual. So such as how they were brought up, perhaps, and some of them were orphaned or they had a single parent. So it captures who brought them up, if they experienced neglect and abuse. It also captures the ongoing support from the family, depending on if it is available. So then, of course, you may also have other codes that would include the experiences with a boyfriend. So because this study was looking at the relationships in terms of sex work, so again, within that space, you're looking at the sexual relationships, when did they get into sex work. So this code captures the previous and current partners, so the number of sexual partners that they have had in the past. So then, of course, it moves on. Then you have another major theme, and the second theme would be sexual and reproductive health. So So based on this, in terms of sexual and reproductive health, you could have a sub-theme that is looking at HIV, STI testing and treatment. You may also have a sub-theme that is looking at HIV, ARV use and post-exposure prophylaxis and PrEP. So this code again would capture the initiation into ARVs, the use of PEP and PrEP. It also captures issues about symptoms, whether there is adherence or not. So this code book was developed out of emerging themes. So one of the things that perhaps you may encounter, and one may ask you, how did you develop your themes? Whether were they emerging themes or they were deductive? Perhaps when we have predetermined themes. For example, you could be looking at your themes based on the objectives, so that you're going clearly saying that even as I look at my data, this is what I want to be able to pick. So already at the back of your mind, you have predetermined themes or predetermined areas that you want to extract from that data. Or you could go into your data and you are going with an open mind saying, let's see what is emerging. So you're looking at emerging themes. And then, of course, from those emerging themes, you're able to come up with the major themes, you're able to come up with the sub-themes, and of course, data that would be informing those sub-themes. So this code book that I'm showing you here was developed out of emerging themes because then the people that were analyzing it looked through the transcripts and they were able to see this is what was emerging across a few of the interviews. And of course, this was developed to support the analysis of the remaining data. So then over here on this other part, so we have the short forms of what a code would be. So you realize that when you look at the theme, for example, the sub-theme, you have the major theme, which is underlying context, and then you have the sub-theme, which is in terms of poverty, and of course, it's a whole segment in terms of a sentence. So when you're coding, many times it may take you a long time having to write all those big sentences. So then you may need to do some abbreviations for each of the sub themes that you are looking at. So then this becomes your code. So you realize that for this particular code, we have UC, U is underlying, and C is the context. And for this code, we are looking at poverty and migration because then we are looking at the aspects of poverty and how they led an individual to move to the urban area. Then, of course, the next one would be looking at the underlying context, and you're looking at the family dynamics, the childhood experiences, and you're saying that it is UC and childhood and family. So then that becomes your code that even as you, for example, if you decided to analyze your data manually, then of course this would be the codes that you'd be assigning along the margin for the segments of data that you'll be coming across. So then this becomes your code book. So it means that if there's an individual that was not part of the research, and was not even involved in the developing the code book, that had not looked at the 3 interviews that initially the team had looked at, then this person is able to use the code book to be able to analyze data, because then there is enough explanation to what each of the themes and the sub-themes would be speaking to, so they're able to extract and be able to assign the right the codes against the data. So that's an example of a code book and how you could develop you may go about developing a code book, because then you have to explain each and every theme or sub-theme as it is. Yeah, so I'll move from that. I'll take this away and go back to our slides. And maybe perhaps before I go back to our slides, I just like to show you a transcript, and maybe perhaps we can look at the transcript, and based on the code book that I've shared, and see if we're able to pick sub-themes or themes. So let's see. Yeah, so I have an example of a transcript here. So from this transcript, when you look at it, yeah, so you're able to look at the context. Where is this person? Where in terms of the family context, for example, the childhood aspect. So assuming you're reading through your transcript and you want to make some sense of what is emerging. So it means that as you look at your transcript, you may be able to make notes, and you are saying that from the review, you are able to say, you can put a comment, because then if it is paperless, then you are able to say perhaps what you are seeing here is demographic aspect. Yeah. So as you move on, so this is what I'm saying in terms of the kind of notes that you can put along the margins to help you, so that even as you look back, you're reading through the transcript and you're able to pick up some of the things that are emerging, and of course you're able to take notes along the margins, so that even as you go back, so that when you're able to sit down as a group or with your team members and say, so for example, let's look at this first transcript from the beginning. So what is it that you found within this space? Yeah, from the first page. So as you read through, you are saying, and it was one person is saying, this is what I found from this segment of data. So you get to understand there's some level of commonality, and perhaps if there is no commonality, perhaps someone else may have a different view. Then you're able to ask one another, where is it that you decided this is what this chunk of a text means and not this? So based on that, you're able to have explanations that help you, so that you have some level of common understanding as you progress with your data. So again, you may decide to put another comment depending on what it is that you found. So you move on. You are reading through the transcript. Initially, you read through the transcript as a story because you just want to be able to get the gist of it. And then you go back again, and then of course start asking yourself, what does this what are some of the issues that are emerging? So for example, then you're able to start putting the comments along the margins as you move on. So having done that, then of course you're able to sit together as a team and be able to develop a code book that informs further data analysis of the remaining transcripts. So that is just an example of how you would go about in terms of reading through the transcript and being able to make notes along the margins. So I'll go back to our slides. There, here. Yeah, so we were there. So in essence, what we are saying is that the data analysis process takes a spiral approach, sort of like where you are beginning from, you have collected your data. And as you've collected your data, of course, you have different forms of data. And of course, you have to think about the management. In terms of management, it means you're ensuring that you have all the data that the data has to be transcribed and it is cleaned. If it was in a language, perhaps in a vernacular language, then of course it has been translated to English. So then that is the data management, and it is properly filed so that you have in-depth interviews and you have key informant interviews. And if it is coming from different regions, you know what data is coming from where. Then based on that, then of course you now go on to reading and memoing. And of course the memoing is what we have mentioned that you're reading. And the first instance is that you're reading through like any other story. And then of course you go back the second time to read, and then of course start reflecting. What is this data speaking? Then of course you begin to write notes along the margins. And of course, perhaps you may also want to ask questions. What are some of what is the meaning of this data? What is it speaking to? Then as you move on, you're beginning to describe the experiences of individuals. And you're beginning not just describing the experiences of individuals, but you're also looking at the different segments of ideas that are coming up in terms of the themes, and classifying the themes. For example, you could be classifying the themes that are under sexual reproductive health. You'd be classifying the themes that are under sex work, entry into sex work. You'd also be classifying all the themes that would be going into the underlying context. So there's that describing, there's that classifying, so that how do you interpret some of the themes? So then based on that, you're looking at the content, yeah? So the content, of course, you're looking at the different segments of data. And then, of course, you're looking at the categories and you're making comparisons back and forth. And of course, as you look through, it means that the same information should also be falling within the same, the book code book that you've developed could also be used to analyze the focus group discussion, because then it means that you'll have looked at the focus group discussion transcript and you'll have looked at the in-depth interview transcript, and they would be speaking to the same ideas that are emerging. Then of course you have your code book, and then of course you're able to visualize. You have analyzed perhaps through NVivo, and you have the data, and based on that you're able to have the segments in terms of how they're speaking perhaps to your objectives, or if they're not speaking to, or you're not looking at the process where they're speaking to objectives, perhaps the intention of the study is also to come up with publications. So based on that, so different people can pick up different segments, different themes, and write papers so that you'd have different accounts of that could be emerging from the data or from the study that you've had, or the different accounts again would be speaking to the objectives of your study. So that is a summary of the steps that I've just mentioned. So you have the raw data, and then of course you organize, you read through, you code, you have the themes, of course the description, then you're looking at the interrelationships, and of course you interpret the meaning of the themes as you put it into a report format. So we've mentioned that, so you could either do your coding deductively where you're using a framework, or inductively where you are looking at emerging themes. And of course you may decide to use a software to help in terms of data management. The thing about qualitative data, unlike quantitative, that even when you're using the NVivos and the atlases, you still will need to read through your transcript. Although now I know that some of these softwares have a way that you can upload your data, and it picks out the themes for you. But the best is for you to be able to read through your data, because sometimes there could also be mistakes, and some of data may be misrepresented. So the coding. So we've talked about the coding. So here we have perhaps a major theme, and we have the sub-themes, and what then informs this sub-theme. So as you look through your data, it means that there could be statements that would be quotes that you would use to support some of the emerging aspects that you're picking up from the data. For example, you'll be you may be talking about fear of needles as a reason where perhaps individuals are not willing where individuals may not be willing to go to a health facility or even donate blood, yeah? So you may have a quotation about perhaps someone saying, I fear needles, or I fear the sight of blood. So a quotation like that would be important, so that you're able to support the argument that individuals, the problems among perhaps the men in terms of blood, donating blood, is about the fear of needles, the fear of seeing blood. Perhaps the experiences may be different from the women in terms of donating blood, or even when you look at the studies that would be collecting blood samples, or would even be collecting mucosal samples. What are the experiences? So then the quotes become very important, because then they support the argument that you're bringing on board. So for example, then of course you have the next step is coding. This image shows the coding is a process of classification. So a good example that I always give in terms of coding, imagine that you have a bale of second-hand clothes. So a bale perhaps would have, it's a bale of shirts, and within that bale you might have blue shirts, you might have long-sleeved shirts, you might also have linen shirts. So then you are able to pull tear up the bill, and then of course pre-select. Some of them might be talk about the very new ones, and they say those are the camera shots, the very nice ones. And then of course among those shots you may also have, some would be green, some would be long sleeved. There could also be shots for children and so forth. So then those become the sub themes. Yeah. Then of course, then you are able to say, were they new shots? Were they old shots? What is the quality of shots that you found? So then those quotes then of course become very important. So then you look at, you're evaluating, you have looking at the bigger picture in order to answer. Perhaps you're looking at an evaluation in terms of services that have been provided. There was a donor support in terms of perhaps UNFPA was supporting family planning in a given area, and you want to look back and see what do community members think about the support that was provided. So based on that, the voices of the people are the quotes, because then they give that human aspect, because they humanize the study. So for example, you may have a mixed method study, and you have the burden of HIV in a given area, or the uptake of services is limited in a given area because of certain reasons. So you want to be able to support the argument with a quotation from individuals that are saying, indeed, we talk about services in this given area. A number of people may have said the services are poor, but what is the evidence when you talk about the services being poor? So a quote would help you in terms of, because then it is the voices of the people that are speaking to a problem that is existing. So these sub-themes can be captured using a code or a label, as we mentioned, for example, the UC underlying, so forth. Yeah. So under those labels, information can be classified in order to be analyzed later. And then of course you have the quotations, and these are verbatim, because then the quotations you do not change, they are verbatim because they're speaking to the voices, they're speaking into the voices of the people as it was stated by the individuals, because then you are not changing the text as it is, because then they have to be representative. So some of the tools that could be available for you in terms of analysis, having done the manual, because ideally we're saying that qualitative data analysis manual, because then you have to read the data to have understanding of what is emerging, so that the in vivos and the atlases only help you to manage the data, so that you're able to have it in form of segments that are easy to use in terms of report writing. So some of the softwares that you may come across that would enable you would be this, as I've mentioned, are not Excel, but DDoS does the mixed method analysis. So we're saying that in terms of managing, start with a clear question. So you need, at the back of your mind, you want to be able to ask yourself, what is it that you're looking at? So even as you read through the transcript, you're looking at asking yourself, what is it that I'm capturing? So work in manageable chunks. So for example, looking segments of data to be able to understand what it is that is being spoken from this data. How does it speak to the research objectives? Then of course, keep an analytic memos along the margins. Then of course, document all decisions as you move on. So as you're looking through the data, you're able to have your notes as you move on. And you recall initially I said that it is very important, even as you're collecting your data, to have debrief meetings with your research team, so that you're able to collect some of the nuances that may not have been captured on the audio. So then, of course, you've done your data analysis. So then how do you then move on to ensuring that you have a report that is speaking? So you're going to be able to ensure that you're able to use the quotes effectively. So when you think about using the quotes, I'll give an example of having a bale of clothes. So when you think about the camera clothes from your bale of clothes, the very nice ones would be the best quotations that you would use to illustrate the issues that individuals would be facing. And then of course the other quotes that are that do not speak much of, that are not very forceful, then of course you use them for the narrative. then of course you're able to tell the story in a coherent manner so that it is able, there is order, there is some form of flow that you're using this, the quote should be able to speak to the narrative that you're providing, being able again to speak, to go back and link to the research objectives or the research questions. So what are these findings speaking to? So the quotes then, of course, you must ensure that you have the right quotes on the right segments of the data. So of importance as you move on is to ensure that because the qualitative research is scientific, so there must be some ensure there's a trustworthiness in the process of your analysis. So you should also ensure there's the credibility of the data that you're analyzing. So in terms of, for example, in terms of ensuring credibility, you recall we've talked about having a team of individuals looking perhaps at the first 3 transcripts so that you have multiple coders, so that within that, then you're able to ensure that you have some common understanding. And then, of course, you look at triangulation. Triangulation is the fact that you have different sources of data, you have in-depth interviews, and you're looking at, you have focus group discussions, you have key informant interviews, and you're looking at the issues of access. What do the healthcare providers say about access? What do the community members talk about access? What do the users of a given service talk about access? So there's that triangulation so that you're able to see what is the commonality of the issues that are being raised. So there's that support from different aspects of data. So there's also member checking in terms of perhaps you could have done the coding on in vivo and someone else may also go back and look through to see whether the codes have been assigned properly. There's also the dependability in terms of ensuring that you have clear audit trails even as you do your analysis. This is important because then it ensures that the right data is speaking to the data that you are analyzing. Then, of course, you're looking at transferability, the thick description. So, for example, you have the code book. Can this code book that you have developed be used by another person that did not develop it? Can someone else just sit down with your data and be able to capture the same issues that have been captured? Then, of course, there's the confirmability in terms of reflexity and documentation. So there's the process of ensuring that you have a systematic way of ensuring that you are confirming the data that you're analyzing, that it is perhaps, for example, if you have different sites, that the data that you're analyzing is speaking to Nakuru or to Mombasa, or it is speaking to the youth. For example, you could have focus group discussion and you had focus group discussion with male youth and you had focus group discussion with the female youth. So ensure that the data that in terms of the way it has been labeled, it speaks to the category of individuals that were participants in that focus group discussion. So what are some of the common pitfalls that you may encounter in the analysis and perhaps how to avoid them? There might be a situation where you are relying on software. For example, I know there are softwares that individuals use for transcribing. But many times, because of from the regions where we come from, perhaps some of the way the information may be captured, it may not be properly captured when it is a software has been used to transcribe. So becomes very important for you to ensure that you have gone through the data cleaning is done so that you have the correct information documented. And of course, we also talked about software because the in vivo can also do the analysis for you. But it is important for you as the researcher to be able to have a view of what your data is speaking. Yeah. So we're saying that you have read through your data, that even if you had to use the software in terms of saying that you're going to ask the AI to pick out the themes for you, but at the back of your mind, you've been able to go through the transcripts. And even when you look at what has been produced, does it speak to what you actually found? So sometimes, again, you may find that the data that you collected may not be fully speaking to the category, perhaps the themes that you would be emerging, especially when you have preconceived themes. So do not force data into categories that they do not fall into. Then, of course, many times again, you may ignore some of the emerging data that perhaps is not within the objectives of your study objectives. So it becomes very important even as you're doing your analysis that you could have a parking lot where you are looking, for example, if you're not analyzing your data based on the study objectives, but you could also have you could also ensure that you're also putting some of there could be data that is emerging that is not based on your objectives, but it is important data that perhaps may inform future research. So do not ignore the outliers in terms of the data, but it may also explain some of the experiences that perhaps individuals would be looking at. So again, do not rush into conclusions. So if, for example, you could be looking at preliminary findings, perhaps you've had the first 3 interviews and then of course you conclude, yeah. So ensure that you have a proper understanding of what your data is before you make the final conclusions. So schedule reflective time. So even as you look at your data, sit back and think about what does this data speak. So we're going back again, where you're reading, work iteratively back and forth. There's no linear approach in terms of qualitative data analysis. Of course, share the emerging findings early so that individuals are also able to, people may also comment on your findings, and also sometimes even just ask you questions. How about this? How is this? How can you explain this? So that is why it is important when you think about the initial part of it, where you're having engagements with your research assistants, and they're able to tell you what is emerging, because then with that, you are able to ask further questions and say, how about if we look for some of this, if we went further and asked for this clarification. So keep research aims visible. So what are the aims of your research? So even as you move on, ensure that the research aims are being responded to. So that is perhaps almost the last slide. We're saying be systematic, but be flexible. Again, stay close to your data, prioritize clarity in the terms of findings. So your judgment is a key tool. Again, in qualitative research, again, we say that the researcher is a tool. So it means that if you do not train your research assistants to understand the research questions, to understand what they're collecting, it means that you may not have the right data to collect, so that even when you're having your debrief meetings, they're able to understand, because they're part of that research process, they're able to make the right judgment. So your judgment is a key tool as you move on. So the key principles is flexibility, transparency, iteration, of course, contextual sensitivity. So different contexts, people would be coming from different contexts. So how do you interpret people's experiences? Then, of course, ensuring that there's that ethical responsibility as a researcher, so that even as you, what is it that you share about your participants? Yeah, that looks like it's the end of our presentation. So I would welcome questions.
Thank you so much, Dr. Emily. There are a few questions here, but I feel most of them you've addressed them. There's a question from Paris Anunda. Does it mean qualitative research has no numerical data? And then there's also a question from Maxwell. What are codes and how do you generate them? I think that has been addressed. And there's this other section here, section B of the question. How are codes different from themes? One more question from Lusweti. Do you generate the themes before study or once you have the transcripts? Yeah, maybe you can attend to those 3 questions.
Okay, so one of the questions that has been asked, does it mean that qualitative data has no numeric data? It cannot be numeric. Okay, qualitative data can be numeric. It's qualitative, but it can also be numeric. For example, you could be looking at an instance where you're looking at uptake of services. Perhaps you look at family planning and the different forms of family planning. For example, you have the coil, you have people that be taking pills, you have people that could be taking the microbicides and all those, yeah. So then you may want to ask yourself, of the participants, for example, if we had 47 women who were interviewed, how many of these were using the pill? How many of these were using were on injectables? So that even when you look at their experiences, for example, they could be telling you about their experiences in the uptake of family planning. And for example, those that are on injectables might tell you about the negative experiences that they have, perhaps back pain, weight loss, or weight gain. So we want to be able to perhaps to quantify of the respondents that you had, how many of those reported pain experiences, yeah. So it is qualitative, but you may also have an opportunity where you are quantifying the data in terms of, we want to be able to look at the magnitude of people that said a given problem. So even when you think about developing a theory, especially when you're coming from an area that is less researched, then it enables you to develop the direction of your research. So you might find that a given aspect was not highly mentioned in your study. So then you might, it might determine the direction that you may want to take in terms of further research. So yes, you can quantify, it is qualitative, but there are instances where you may also quantify, especially when you're presenting your findings and saying that indeed this is a problem within this area. But also you may find that there was also another, a few of the participants said ABCD. So there can be an element of quantification. And then the other question, Joyce, would you please repeat the other question?
Yeah, from Maxwell Omonti.
Yeah.
What are codes and how do you generate them? How are codes different from themes?
How are codes different from themes? So you have a subcode, you have a major code, you have sub-themes, you have subcodes, yeah? They're almost used interchangeably, yeah? So you're looking at your data and you are looking at the emerging issues, and you give the emerging issue a name. For example, you could talk about adherence to treatment, yeah? So that is a theme, but it could also be a code. And then, so of course, you look at the subcodes, the sub-themes that would be coming down, or the subcodes. So then, of course, you're doing thematic analysis, you're looking at the themes, but then now you use them as codes. Whatever you develop becomes a code. Maxwell, have I answered your question? Thank you.
Yeah, he may not be able to respond to you. But another question from maybe one more, from David Loswete. Do you generate the themes before study or once you have the transcripts?
Do you generate the themes before the study?
Or once you have, yeah, either is it before study or once you have the transcripts?
So you cannot generate the themes before. You can have predetermined themes based on the objectives, so that you're saying when you collect your data, you're going to be looking at, so you want to be able, the data that you have has to speak to these objectives, yeah? So within those objectives, you can look at what are the sub-objectives. So along the sub-objectives, yeah? So you are pulling from your data, you want to be able to pull the data to speak to the sub-objectives, to the major objective, and then of course to the sub-objectives. And based on that, from those sub-objectives, you're looking at the quotations, the segments, the statements from the interviews that would be speaking to the sub-objectives. But again, we're saying that you could develop your themes. You remember I mentioned that you could be having debrief sessions with your research team. So at this point, you're beginning to have a preliminary analysis of your data, and you would almost actually have preliminary findings that you could even share in a forum. And based on the engagement that the discussions that you're having with your research assistant, because they're sharing what their experiences have been and what data is emerging from the interviews, you can begin to develop your code book and can begin to develop your themes. And of course, as you progress, then you're able to refine the themes as you come to, as you get the data, and I mean, you get the transcript transcribe, you get the audios transcribed so that you're able to now begin the actual reading through to be able to come up with the code book. So as you read through, then you can use what you had developed, sort of like a draft at the starting point, using the what you had picked from the research assistants or even from the notes that had been shared. Then you are able to refine the code book further and have a final code book. So it is a continuous process.
All right, thank you. Thank you, Dr. Emily. Maybe with two more questions around data management. Kelvin, Patricia Rode, how do we minimize any bias that may arise when translating information from the participant to the research personnel? How do we minimize any bias that may arise from translating information from the participant to the research personnel?
How do you minimize bias? Okay. So one of the things I've mentioned in qualitative research, when you think about the data that you've collected, you have the interviews. Remember, you as the researcher, for example, you are the owner of the proposal, and you have a team of research assistants that you have engaged to help you with the data collection. Yeah. So the reason why we are saying that all data should be verbatim is because you are the one who knows what you're looking for. The research assistants does not know what you're looking for. So they should give you the data as it is, because then if you allow them to interpret the data, they may miss out on perhaps what would be very important in terms of speaking to your research object. They may miss the gist, yeah? So what they may consider not important might be missed out. So hence, it is important for them to give you the data verbatim so that you're able to read through and pick out what speaks to your data, then because then that minimizes the bias.
Dr. Emily, probably the question is about translation, not transcription. Translating information from participants. You're translating from one language to another. How do you ensure that?
When you're translating the from one language to another, there is the back translation. So for example, even when you have your research tool and you've asked someone to translate your research tool to Kiswahili, ideally the best would be to ask someone else to back translate this Kiswahili tool back to English, so that you look at what is your original tool. This is what your original tool was, and this is what was translated to Kiswahili. And then you have someone else back translating into English, so that you're able to see, does it speak the same language? But again, in terms of the data that you have collected, so it helps sometimes to have someone else. For example, you have a transcript that was done, you have an audio that was done in Kiswahili, and it has been translated into English. You may have someone else, depending on the resources that you have, you may have other people that would go back again and listen to the transcript, listen to the audio, and look at what has been written down. Does it speak the same as what has been recorded? So that is why, again, it is very important to ensure that the individuals that you engage in your study are properly trained. Why am I saying so? So that, for example, many times people engage people as transcribers who may not have gone through the training. So even as you're doing your training for the research assistants, ensure that some of the people that you want to engage as transcribers are also part of the training, so that they be able to understand what your study is about, the terminologies in your study, so that even when they are doing the transcription, they have understanding. Again, the other thing that usually happens, so assuming I went to the field and I collected data, so as the research assistant, I should be having accompanying notes. So for example, I have a focus group discussion. Then I should have the notes that were collected alongside the audio, so that the person who is transcribing, in instances where some of the information may not be inaudible, then they are able to look at the notes that were taken and perhaps make sense out of it. Again, the ideal again is to go back to the people that did the interview or were in part of the focus group discussion and ask, especially in instances where the audios are inaudible, what was being said here, because then they're able perhaps to recollect what information was being conveyed. So that way you're able to lessen on the biases, perhaps even just losing out on what had been said.
Thank you. Thank you, Dr. Emily. Just one more question. How can a researcher effectively document and manage their own? How can researchers effectively document and manage their own biases throughout the research process, analysis process?
Aha. How can you manage your own biases, yeah? Through the research, through the research process and the analysis process. So again, it takes you back. For example, if it is a phenomenological study, there are elements of where individuals are asked to bracket their own ideas. For example, you could be a medical doctor and you want to be able to assume, you want to be able to sort of like assume this is what was said and not what was said, yeah? So it is important to have boundaries in terms of positionality. We talk about positionality in research so that because it enables you to demarcate your boundaries in terms of how far you go and perhaps in terms of what your prior knowledge, how your prior knowledge may influence the processes. Then because you're able to sort of give yourself, or rather you're able to determine the parameters within which you are able to operate. And again, of course, that has to be documented from where you're coming from. For example, you could be a healthcare provider, but you're looking at scenarios where there could be patients that you've commonly seen, but they may not be projecting some of the issues that you've been seeing within your health facility. So because again, you're looking at the context, because different contexts, different areas may present different experiences. So it becomes very important to create boundaries so that you are able to look at the data from an outsider view. I think that's the way I'd look at it. So managing positionalities becomes very important.
Okay.
Joyce, have I answered the question?
Yes. I think we've come to the end of our webinar today. More questions are coming. But I think most of them have been addressed during the presentation. So I want to appreciate each and every one of you for joining this webinar. And again, I take this opportunity to appreciate our facilitator, Dr. Emily. Thank you so much for walking us through the topic with such clarity and depth. So we appreciate your time. To our participants, thank you so much for being part of this webinar. And I want to say that the whole session has been recorded and will be made available. And again, I want to appreciate Kenyatta National Hospital Research Department for hosting this webinar session. And as I conclude, I hope you live here with new knowledge, fresh perspectives, and continued interest in the power of qualitative research. And so once again, thank you so much. And we look forward to connecting with you in future session. So good night and thank you all.
Thank you.
Thank you to the core team again. Just to inform you that the recording of this session will be uploaded to the KNH Research YouTube page. That is at KNH Research, or you can search for KNH UON webinars on YouTube and you'll be able to get this and the previous recording. The previous recording was on quantitative analysis, and this will be a follow to that one. So thank you for joining us today. We will be communicating on the next upcoming installment in the data analysis series. So kindly be on the lookout on your emails. Thank you once again and have a good night.